2 in the morning, they're pacing the house, they're confused, they think it's daytime, and you're exhausted. So you grab something from the medicine cabinet, Tylenol PM, Advil PM, Benadryl, Unisom. The label says sleep aid. It seems safe. Everyone takes these things if they need a little help falling asleep, right? But if your parent is on a dementia medication, these pills are blocking the exact chemical the prescription is trying to boost. I'm David, the lead pharmacist at MyRxPro. And I'm going to tell you what these medications actually do to your parent's brain and the 3 steps to help them sleep. If your parent is wide awake at night but exhausted during the day, this is a common symptom of Alzheimer's disease. During the moderate to severe stages of Alzheimer's disease, physical damage occurs to the brain's circadian rhythm. Because of this damage, the brain stops producing melatonin at the correct times. Your body loses the ability to distinguish day from night. This severe disruption is exactly why caregivers get desperate and reach for the over-the-counter PM meds. Now let's talk about chemistry. One brain chemical controls memory, learning, alertness, and is called acetylcholine. In a healthy brain, acetylcholine is abundant. In a dementia brain, it is dangerously low. That's one of the hallmarks of the disease. So what do doctors do? They prescribe a medication like Aricept or donepezil. These drugs try to preserve whatever acetylcholine is left. You use these prescriptions hoping it will extend memory a little longer for your parent. Now here's the problem. Most over-the-counter sleep aids are called anticholinergics. Anti meaning against, cholinergic meaning acetylcholine. When you give your parent an OTC sleep aid, you're giving them a drug that blocks the exact chemical needed for memory. You are actively canceling out the medication prescribed to help with their memory. If these OTC drugs are in your parent's medicine cabinet, I suggest you throw them away immediately. The first one is diphenhydramine. This is the active ingredient in Benadryl, but pharmaceutical companies put in almost every PM product. Tylenol PM, Advil PM, Aleve PM, Motrin PM, same chemical, different branding. The second chemical to look for is doxylamine. You'll find this in Unisom and most over-the-counter nighttime cold medicines like NyQuil. In a young person, these cause mild drowsiness. In an aging body, especially one with declining kidneys and liver function, these drugs stay active for 24 to 48 hours. The result is severe brain fog, increased fall risk, and a confusion that looks exactly like dementia progression. Except it's not dementia, it's drug-induced, and it's preventable. Your parent still needs to sleep, you need to sleep, so here are the 3 steps research says to take if you find yourself in this situation. This is compiled from peer-reviewed science, not guessing. First is your environment. Your parent's circadian rhythm is broken. Fix it with light. 20 minutes of direct sunlight before 10 in the morning, every morning. This resets the biological clock. No sunglasses, but you can use a window that gets direct sunlight. I live in Portland, Oregon, so I know how hard direct sunlight can be sometimes. Therefore, a light therapy box can be helpful. During the day, keep them active. Movement, engagement, conversation. A tired body sleeps better. Alright, in the evening, enforce a strict screen ban 1 to 2 hours before bed. Switch to calm music, soothing podcasts, or relaxing audiobook. Do this for 2 weeks before moving to melatonin. Second is melatonin. If environmental changes alone aren't cutting it, melatonin can be helpful because your brain is no longer producing melatonin. But here's a critical detail. A little goes a long way. Most over-the-counter melatonin is sold in 3, 5, or 10 milligram doses. In aging brains, especially dementia brains, these high doses can cause nightmares and hallucinations. The clinically effective dose is much lower, 0.3 to 1 milligram taken 2 hours before bed. Melatonin is not a supplement, it's a natural hormone, but you'll want to talk to your pharmacist just to make sure this won't interact with any of your medications. Step 3 are prescription alternatives. If environmental changes in melatonin aren't enough, ask your doctor about orexin antagonists, medications like Belsomra and Dayvigo. Here's why these are different. They target the brain's wakefulness centers without blocking acetylcholine. They work without blocking the memory pathway. They don't work for everyone, but they are safe alternatives to try. Here are the timeline of what to expect.
If your parent has been on anticholinergic sleep aids for a while,
their brain fog won't clear overnight. It will take 2 to 4 weeks for the chemical to leave their system completely. That's normal. It takes time to clear. But what should happen, alertness will improve and confusion will improve, and you won't have to watch their cognitive decline accelerate while you try to find them sleep. Here's what I suggest doing this week. Tomorrow, go to the medicine cabinet. Check for diphenhydramine and doxylamine. If you find them, throw them away. When you give your parent an OTC sleep aid, you're giving them a drug that blocks the exact chemical needed for memory. You are actively canceling out the dementia medication prescribed to help them. This week, implement environmental changes. 20 minutes of direct sunlight before 10 a.m. every morning. This resets your parent's circadian rhythm. 1 to 2 hours before bed, dim the lights, eliminate screens, avoid sugar. You're creating a wind down signal. During the day, make sure your parent is moving and engaged. Do this for 2 weeks before adding any medication. At the next doctor's appointment, bring this video to your parent's doctor. Ask about low-dose melatonin or orexin antagonists as alternatives. Want a guide for how to bring this up at the next doctor's appointment? Use the one-page 8-minute briefing to organize your priorities. You can find this in the Caregiver's Toolkit along with other useful checklists designed to help you navigate the healthcare system. I'm David, founder of MyRxPro. I hope you found this helpful. If you're dealing with sleep issues right now and want expert guidance on your specific situation, we offer 15-minute triage calls with me. If I can't give you actionable advice, you don't pay. Link is in the description. Thanks for watching. See you in the next video.